Hello everyone, I am NUPUR. Welcome you to this presentation on healthcare system of India during the crisis of COVID-19. In this video, my team will be mainly focusing and discussing about major problems during this crisis. I would like to start with a quote. Being human is not the best quality of a human being. The medical profession was started to serve human beings. But it's changing to be the business in today's world. Isn't life same for everyone? Is it different for the rich and the poor? Now I would like to call Akshit to present his views.
Thank you, Nimpu, for letting me present my views. I would like to talk on the main problem on healthcare system in India during COVID crisis. Scenes of mass death are now unavoidable in what's often called the world's largest democracy. Social media is filled with images of body bags and urgent requests for medical aid. Indians gasping for breath are being turned away from overwhelmed hospitals, sometimes simply because they don't have live reports confirming COVID-19 infection. Health workers plead for basic supplies every day. Hospitals in India have been facing an acute shortage of oxygen, ICU beds, and ventilators ever since the second wave of coronavirus infections hit the country with rampaging ferocity. Government data shows that instead of strengthening hospitals after the first wave, the country saw a drastic fall in health infrastructure. Clearing the fog of propaganda about how well the country did, and there does not seem much to defend in the first year of COVID-19. Just before the second COVID wave hit India, ICU beds decreased by 46%, oxygen once by 36%. Hospitals in India have been facing an acute shortage of oxygen or ICU beds since then. Thank you. Now I'd like Ahmed to continue.
Thank you, Akshit. So before we discuss how to empathize with the stakeholders, we have to understand what empathy actually means. To understand what empathy actually means, empathy is the capacity to understand or feel what another person is experiencing from within their frame of reference. That is, the capacity to place oneself in another's position. The COVID-19 pandemic has led to sweeping changes and disruptions in nearly every aspect. It's easy to feel overwhelmed by our own anxieties. It is important to practice empathy during this time, not only for others, but for yourself as well. There are many benefits to practicing empathy. Empathizing with others can help you feel less lonely and more connected. Some of the ways to build empathy are as follows. Number one, stay connected. Researchers suggest that caring about others is one of the best ways to fight feeling of isolation. Number two, be kind. Take it easy on yourself and others. It's okay if you aren't managing to do it all. It's okay if your kids are watching a little too much TV. Cut yourself some slack and practice self-compassion. These are some of the ways to empathize with others. But now we move to the most controversial topic with respect to Indian society and the government. India needs to treat its empathy deficient disorder. Now, in the middle of a COVID-19 storm, many politicians and bureaucrats seem to be preoccupied firefighting photographers, tweets, and hashtags. Then they are tarnishing India's image abroad, than fighting the actual fire raging in India itself. The optics of the issue start looming larger than the issue itself. Nowhere is this more apparent than in Uttar Pradesh, where the government thinks one way to tackle a public health emergency is to put up plastic and cloth banners to hide cremation grounds from cameras. The government would naturally prefer images of oxygen express delivering oxygen to those of funeral pyres. But the way to do that is with more initiative like the Oxygen Express, not by hiding funeral pyres. Now, we move to the next topic, role of stakeholders in health system in India. Stakeholders play a major role in ensuring successful adaptation of evidence in healthcare. Their support is necessary because they provide resources, skills, and knowledge required for project implementation. Moreover, they influence the public opinion in regards to the projected change. To secure the support of stakeholders, it is important to inform them about the project in its interactive forms. Thank you. I will pass to Nupur now.
Despite of these health needs, total health expenditure in India represent only 3.9% of GDP, well below the 5% minimum recommended to achieve universal health coverage. The nation remains starved of the resource needed for the robust, resilient, and well-equipped health system. What money is spent goes into an expensive hospital-based system, predominantly delivered through the private sector. Most people do not have insurance and pay for care out of their own pockets. Medical problems during lockdown. Pregnant women's healthcare suffered in the lockdown. In West Bengal, only 29% households with pregnant women confirmed checkups and vaccination. Rajasthan reported the highest at 87%. Vulnerable groups such as tribal communities are largely dependent on the government hospital for health services. These have now been converted into COVID-19 facilities. Giving services in these public hospitals is affected. These marginalized groups have suffered the most in the lockdown. Now my colleague Satya is taking over from here.
Thank you, Nupur. Now, giving a break to this topic, let's redefine our problem. Redefining a problem. Why is it necessary? Let me explain. Albert Einstein once said, if I were given 1 hour to save the planet, I would spend 59 minutes redefining the problem and 1 minute resolving it. While that may sound extreme, it does highlight the importance of defining problems. It also hints at some interesting facts. A well-defined problem often contains its own solution within it, and that solution is usually quite obvious and straightforward. By defining problems properly, you make them easier to solve, which means saving time, money, and resources. So today, we are going to redefine the problem of the greatest pandemic of the world, COVID-19, aka coronavirus. Condition of our healthcare in India. India has just 0.8 doctors per thousand population as against Italy's 4.1, China's 1.8, Spain 4.1, Iran 1.1 and USA's 2.6. India has just 0.7 hospital beds per thousand population as against Italy's 3.4, Spain's 3.1, Iran's 1.5 and the USA's 2.9. Air pollution is closely associated with lung and heart disease. A whopping 7.8% of all deaths in India were due to pollution in 2019. And Delhi, currently flooded with COVID patients seeking oxygen, is the most polluted capital in the world. Thank you. That's all from me. Now I would like AKSHIT to proceed further.
Thank you, Satya. I'm going to talk about how COVID-19 triggered an introspection of India's healthcare system. Talking about treatment and viewing of healthcare system. The headlines of the tragic loss of lives, the exponential increase in cases, economic morass, and social disruptions have emerged a deeper subtext of how the healthcare sector is viewed and treated. Emergence of reports on healthcare problems. The pandemic has raised reports on long-standing problems of healthcare workers protesting the shortage of equipment, patients charging doctors and hospitals for profiteering, policymakers issuing edicts against providers and reported cases of hoarding of essential medicines, increasing lack of interest between stakeholders of the health system. The growing lack of trust between patient and the doctors and providers and the wider mistrust between policymakers and the industry found fresh ground during the pandemic. What are the other challenges? One big challenge is how to bring undiagnosed or untreated ailments into account. Self-reported morbidities from successive national sample surveys suggest a larger proportion of ailments go unrecognized and undetected. Enhancing health literacy and knowledge is the key for reporting, diagnosis, and treatment of ailments. Thus, unless the public healthcare system is revamped to increase health infrastructure and healthcare human resources and make healthcare affordable to the poor, it is difficult to bring people to seek treatment for all ailments. Mere insurance-based, basically private healthcare does not work effectively in a country with multiple social and economic hierarchies where 62% of the total healthcare expenditure is incurred by households. Thus, raising the demand for healthcare and treatment-seeking behavior will not be possible without enhancing public health provision from bottom-to-top approach access to affordable and quality healthcare in rural areas. Also, the country must develop a clear framework and pathway on ways to bring its private sector into confidence under NDHM, adhering confidentiality and ensuring quality of information. Data with the National Clinical Registry for COVID-19 shows a new emergent trend during the second wave. Shortness of breath is the most common clinical feature amongst symptomatic hospitalized patients at 47.5%, compared to 41.7% during the first wave. On 24th May, members of the National COVID-19 Task Force said hospital data shows that a significant 54.5% of hospital admissions during the second wave required supplemental oxygen during treatment. This was a 13.4 percentage point increase compared to the previous wave between September and November. The data from 40 centers across the country shows, according to the pictures. Thank you, and now I'd like Ahmad to continue.
Thank you, Akshit. Now, I would like to present. Thank you, Akshit. Now, let's discuss how coronavirus was used as a political tool in India. The National Vice President of the Indian Medical Association, IMA, Dr. Navjot, has called Prime Minister Narendra Modi a super spreader and blamed for the second wave of COVID-19. Despite the severity of health crisis, election rallies and religious congregations like the Kumbh Mela in Haridwar continued, raising questions over the seriousness of Modi-led union government to tackle the spread of the deadly virus. The top officials of the IMA further said Prime Minister Modi did not hesitate to address big political rallies, tossing all COVID norms in the air. Dr. Navjot told. The impact of pandemic was clearly visible across the country, with bodies piling up in crematoriums and long queues of ambulance outside hospitals in almost every city of the country. Despite all this, the political parties didn't hesitate to call rallies and hold people for votes and what so on. Well, that concludes our presentation. Thank you for listening to our presentation, and please do like, share, and subscribe to our channel.